Hello again. It's good to see you today. Now that we've talked about some key principles that will help you navigate your treatment, we're going to talk about the specific treatments that are available. We're going to start with medications. Now, the paradox about medications is that most people with BPD are taking some form of psychiatric medication. And yet, no medication has been proven to be effective across studies for the treatment of BPD. Because of this, there are no medications that have been licensed for the treatment of borderline personality disorder. There's this tendency for people who have borderline personality disorder to receive more medications over time because the treatments that they're receiving aren't working. This is known to be inversely proportional to improvement, meaning that the more medication they get, the less they improve. Now that I've told you a little bit about the state of knowledge about medications for the treatment of BPD, I'm going to talk to you about the approach you can use in working with your healthcare professional about the management of your medications. First, whenever you're taking a medication, it's really important to know what you're trying to target. That is, which symptom you're trying to improve. So when you're working with a healthcare professional who's treating your borderline personality disorder, be clear about the goal. Once you clarify what you're trying to improve with this medication, you can track your symptoms. It's important to regularly take note of how you're doing in terms of the symptoms of BPD, which we reviewed in our first talk. It's also really helpful for patients to think about the benefits versus the costs of taking any medication. You can approach this by thinking about the benefits that are derived by taking the pills that you have. You'll need to weigh that against its costs, whether that's financial or how much time it takes to organize that medication and take it as prescribed. Lastly, you'll have to consider side effects, both the ones that you notice on a daily basis, as well as the risks, for example, for birth defects should you get pregnant while you're taking the medication. The last thing you should know is that some medications will make you feel better immediately, but they also interfere with your efforts to improve your functioning. For example, many medications can cause sedation. That makes feelings and impulsivity feel reduced. However, at the same time, that sedation can get in the way of functioning. A key tip we have for taking medications when you have borderline personality disorder is to think about whether or not the medication helps you in the service of functioning better in your life. Lastly, we'll talk about the specific medications. We'll start with antidepressants. They're very commonly prescribed to patients with many diagnoses. They're of uncertain value for the treatment of borderline personality disorder. The studies show mixed effects, and none of them are consistent. In addition, we know that antidepressants don't help in the treatment of depression as consistently or as much as for patients without BPD. The medication that seems to work the best for BPD is anti-psychotics. These work on a range of symptoms, including the mood instability, as well as the impulsivity involved in BPD. Furthermore, antipsychotics can help a person be more organized in their thinking. What I'd recommend is this is used in low doses for a short period of time. You can always go back on it if you need it later. Mood stabilizers are the next class of medication. These medications are oftentimes used by neurologists for the treatment of seizures and migraine headaches, as well as by psychiatric professionals who are treating bipolar disorder. These medications over the studies have not proven consistently to reduce the symptoms of borderline personality disorder. This may be confusing to some people who have been on mood stabilizers because they feel better on the medication. But more recent studies have shown that even a pill that's called a placebo, that's just a pill without any medicine in it, can make people with borderline personality disorder feel better because they're having someone recognize their problems and give them something that they think can help. Lastly, a lot of people take benzodiazepines. This medication class is typically used for anxiety and insomnia. For people who have BPD, this is not recommended. There are 2 reasons why. The first is that benzodiazepines are habit-forming even when you take the medication as prescribed. It just biologically works that way. The second reason is that benzodiazepines cause what we call disinhibition. That is a lack of control over your behaviors. So as you can imagine, it can increase your impulsivity and lack of control over your actions. So that's the review of what we know about medications in the treatment of BPD, and also what you can do to work well with your healthcare professional in decisions you make about whether or not to take medications. I hope this helps you to clarify a way forward to decide for yourself what's helpful and what's not helpful for you in the use of medications in your treatment. Thanks for listening, and I'll see you again tomorrow.